Mark! Honey! You're home early.
Yeah. And you're not.
When we respond to the report of sexual assault or of domestic violence involving strangulation, we are already accustomed to asking the victim about the details of the incident. We know that during these violent encounters, impacts to the head often occur, but until now have had little training in the signs and symptoms of concussions.
Scientists and physicians have come to learn that near-point convergence is sensitive to concussion or traumatic brain injury. Victims cannot bring both eyes together to focus on a single target at close range. Gathering these data require efficient, accurate, and reproducible dynamic measurements for which Concuverge is perfectly suited.
What we do is have the patient look at the target on the front of the Virgil. We bring it towards them until having them watch the X until the X doubles. That's the measurement called near point of convergence. We bring it back out until they say single again. That's the near point of convergence recovery. We start it back out here, having them look at the top line of print. We bring that towards them until that gets blurry. That's the near point of accommodation. And then we bring it back out until that gets clear again, and that's near point of accommodation recovery. Those four measurements go a long way in helping us diagnose whether there is a concussion or not.
This program begins with patrol officers, then leads to a more complete concussion evaluation for the victim by medical personnel.
When victims of domestic violence are brought to our facility for medical evaluation, an Honor Health forensic nurse examiner will perform a complete medical forensic exam following strangulation or sexual assault. For this project, we expand the examination to include a series of concussion tests, including a repeat of the near-point convergence test.
After a victim advises that they were either sexually assaulted or strangled during a domestic violence incident, our normal protocol is to ask them if they will consent to seeing a forensic nurse examiner for a medical exam. If they consent, ask them something such as, "During incidents such as this, you may have experienced a concussion. Would you mind taking a short eye test to assist the medical professionals to determine if you did?"
That's fine.
After they've consented, retrieve the device. Press the on button to turn the device on. Press up or down until it shows Add Patient. Press Select. Enter the DR number. Press the back button to return to the main menu. Press the arrow up or down until it says Select Patient. Press Select. When you have the correct DR number, press Select to test. The screen will now display 4 sets of zeros and the DR number. Holding the device about 24 inches or 2 feet from the victim's eyes at eye level, tell them to watch the X on the device. Focus on the X. When they see the X split in two, tell them to notify you. I'm going to move the device towards you. Let me know when the X splits in two. Press and hold the select button and move it slowly toward the victim. When victim advises they now see 2 X's, release the select button.
There.
Keeping the device there, press and hold select again and tell them to let you know when the X's come back together. Now I'm going to move the device away. Let me know when the 2 X's become 1. Slowly move the device back and release when they tell you they only see 1 X again.
There.
Now instruct the victim to focus on the top row of letters. Focus on the top row of letters. I'm going to move the device towards you. Let me know when the letters become blurry. Press and hold select again. Move slowly toward the victim and release when they tell you the letters are blurry.
There.
Keeping the device in that position, instruct them to tell you when the letters are no longer blurry. Now I'm going to move it away. Let me know when the letters are not blurry. Press and hold select and slowly move the device backwards until the victim tells you it is not blurry.
There.
Release select button. You should now have 4 numbers in the areas that were previously displaying zeros. You may now shut the device down by pressing the off button. At a later time, follow the directions on the instruction card included with the device to ensure the data gets forwarded on.
With the data and experience from this program, our short-term goal is to break the cycle of intimate partner violence by getting the concussed victim medical treatment. The long-term objective is to be better informed so that abusers can be held accountable for their abusive conduct, even when the injury, like traumatic brain injury, is not readily apparent. We have the utmost gratitude for the Mesa Police Department in joining the initial phase of this project.